Okay, so thank you everyone for tuning in to what we're now calling HAWKEY TALKIE. I'm delighted to have as my guest today Dr. Ed Laskowski, who is a former member of the President's Committee on Physical Fitness and Sports, serving under both Presidents Bush and Obama, and the former co-director and currently professor in Mayo Clinic Sports Medicine in the Department of Physical Medicine and Rehabilitation. Ed, thank you so much for joining me.
It's a pleasure to join you, Adam. It's a great topic, and I look forward to talking about it.
Great. Ed and I actually met last year when we were both keynote speakers in Malta for a sport, exercise and medicine conference. And Ed gave a fantastic presentation on exercise as a medicine. So I know a lot about him and what we're going to talk about today, but for everyone watching, Ed, can you just give us a little bit of a background of yourself and your career and your work as an advocate of physical fitness?
Sure. Well, thanks, Adam. I always, was active as a kid. I actually was on the U.S. ski team. So I used to downhill ski, and came a decision, my dad, to go to college or continue with that, and it was college. So it's a wise decision. And so all throughout college, I played some tennis and all, but really became interested in just movement and just physical activity. And my specialty kind of combines that. I remember it was one of the ski team guys got a bad ankle injury, shattered ankle, and I visited him at his hospital room, and I saw the x-ray. Those days the x-rays were up on the box, and the ankle was all put together again with screws and plates. And it was interesting because his doctor came in, his orthopedic surgeon, and he told this guy, he was a great member of the U.S. ski team, he said, "Okay, Phil," he goes, "10% of the job is done." And I'm like, 10%? You fixed him. He's all set. And he goes, no. Now you got to do the rehab. You got to do the exercise. You got to do. I was like, whoa. So that kind of got me interested in just activity and exercise. So throughout my career, my specialty kind of combines movement and restoring function in people, whether you have a stroke or spinal cord injury or an athlete. So that's kind of what my research focus has been throughout the years, and my practice focus. And as you mentioned, I was fortunate enough to serve 2 administrations on the President's Council on Physical Fitness and Sports here in the United States. We, as the world does, and we're no exception, unfortunately, we're number 1 in the world as being the most obese nation. So we have an epidemic, certainly, of obesity and sedentary lifestyle that is affecting quality and quantity of life. And so those are the things that we both work on and try and make a difference on.
Sure. That's great. Thanks for that background. And I think you started to touch on that there. So we'll move straight on to that in terms of, let's talk a little bit about, the dangers of sedentary behavior on health. If you can just give us a bit of enlightenment in terms of the major areas that being sedentary have a negative impact on.
Well, it's interesting, Adam, as you know, even if you get activity during the day, if you're sedentary during most of the other parts of the day, say you even get your 30 minutes a day of physical activity, but you sit for 8-9 hours, there's metabolic effects that are harmful as far as insulin resistance, as far as lipid profiles, things like that. So really, movement is medicine, exercise is medicine. And if we don't do it, we're losing a lot of the benefit of what we could. Our bodies need movement, our bones need movement to maintain bone mineral density. Our heart, cardiovascular system needs exercise and movement to maintain its strength and its stability. And when we don't do it, and when we have this in the United States, we have an epidemic of obesity. We have our kids and our adults, only about 1/3 of people in the United States probably get the activity they need. So we're finding increasing levels of obesity-related diseases like type 2 diabetes. And we're finding it in young kids now. We never used to see this before in kids. And now there's been reports of kids as young as 7 years old having type 2 diabetes. And in young kids having cardiovascular risk factors and coronary calcification, things like that. So our sedentary lifestyle and our kids as well, if our kids aren't getting movement, they're early on setting themselves up for bad things later. And about 70 to 80% of overweight kids will become overweight adults and carry that burden onto society and to themselves. My specialty, we deal with a lot of people with arthritis, and it's an incredible ratio. When you gain a pound in your midsection, it's about 4 pounds of load and force on your hips and your knees and lower extremities. So you can imagine the people with osteoarthritis, with joint-related problems, they're just magnified with obesity. So, as we both said, Adam, if there were a medicine that could contain all the benefits of exercise, it would be the most prescribed and best-selling medicine we could ever have in the world, because there are so many benefits to our bodies, both physically and mentally, of movement and of exercise.
Sure. So let's talk about some of those specific advantages then. So we've obviously spoken a little bit about kind of diabetes and heart disease. You've mentioned bone disorders, so we can, osteoarthritis and osteoporosis. What do you think are some of the major benefits of this? Let's call this, this drug that we call exercise, this medicine, this pill. What are the main factors that exercise does for us in terms of improving our health and well-being?
But it's a great question. We have the physical activity guidelines for Americans, which I was fortunate enough to be involved in initially in 2008. And we just revised them in 2018. And it's interesting, even in that time period, the myriad of benefits, there's now documented voluminous evidence, not just single articles, but 13 separate cancers are influenced by exercise as far as being protected and being actually reducing risk, even when improving status when you get them. So 13 separate cancers. We find things you may not think about with activity, like psychological things, anxiety. That's one of the most immediate effects of activity. And in fact, we kind of broke them down into immediate effects, intermediate effects, and long-term effects. And right away, if you're anxious, you go out for a 30-minute walk, you feel better. You feel less anxious right away. So that's one of the immediate effects. But psychological effects, exercise in some studies is more effective than Prozac or cognitive behavioral therapy for depression. We have an aging population, so if it increases incidence of dementia, prevalence of dementia, exercise, that we've done some great studies here at Mayo. Ron Peterson has shown that actually activity modifies your risk of dementia and modifies your risk of Alzheimer's disease. Huge impact there. So those are areas we made. Parkinson's disease, we're now first-line treatment. In fact, the American Neurological Society, the first-line treatment for new onset Parkinson's is exercise. In our sports medicine facility, our neurologists actually refer patients to us to get an exercise program. It's that powerful and that evidence-based that more than any medicine initially, exercise is the treatment for that. So we look at the physical realm, like you've mentioned, with heart disease protection, with cancer protection, with modification of our lipid profile in a good way. It'll raise HDL, the good lipids, and lower LDL, the bad lipids. It'll make us more resistant or less resistant to insulin effects. So we'll have less risk of type 2 diabetes. It'll protect us from cancers. It'll protect our mental health and our well-being, so depression, anxiety, and even our risk of dementia. So again, it's so astounding, really, that all these, and again, these are not just, there's a single study that might show we're going through COVID times, we're trying things that work now, and we're saying, well, boy, does this work? These are multiple studies that have been studied over years that find these things. So it's not just one thing, it's a whole mess of things that it influences.
Sure. And we obviously know that. We work in this kind of day in, day out, week in, week out. Why do you think people aren't taking up this medicine? Why do you think people aren't kind of exercising enough? What are the barriers, do you think, to being involved in this kind of physical activity?
Boy, that's a great question, Adam. And there's probably a bunch of them. I think technology has made us more sedentary, and we're seeing, I lectured in China a while back, and in China now, 20 to 25% of some of their industrialized cities are obese, which was unheard of. But China's becoming more affluent. They're becoming able to afford technology. They afford fast food now. That's just bad for them. So they're kind of in that same realm. So I think there's a lot of factors. I think technology keeps us sedentary, and it's harder to move. One study even looked at TV remote controls, found it was about a 200-300 calorie per day difference, just getting up and changing the channel versus having a remote. So I think that's part of it. I think there's some fear. One of the things we say, we like the term physical activity. I know you use that too, Adam, instead of exercise, because sometimes exercise implies like you have to go somewhere, you have to put on spandex, you have to sweat bullets, and you don't. You really just movement. Movement is medicine. So just moving throughout your day. And again, in those physical activity guidelines, we used to have 10-minute kind of minimums. Now, no minimums. Anything is good. Any movement is good. So I think it's more enticing to people if they know that, hey, just walking is great. You can get fantastic benefit if you like to walk. You don't have to run a marathon. You can if you want. If that's a goal for yourself, fine, but you don't have to be very fit. It's just that movement. So I think dispelling some of those myths, because they say, I can't run marathons, or I can't do that, or sometimes they see these numbers even that we say, well, 150 minutes of moderate activity. Oh, I get sore, I can't do. You can accumulate that throughout the day with a lot of things, taking the stairs, parking farther away, going for walks during lunch breaks. So the more you can make it enticing and easy for people to do, you don't need special equipment. You don't need to have a fancy gym membership. These are all basic things. And I think the more people can hear that, and then I think the more people can hear the dangers, really. And, one of the lectures I give, there was a New England Journal of Medicine article that looked at BMI, which again is not perfect, but it's still a nice measure of where you're at as far as body weight. And they looked at people with BMIs of 25 to 29, which is in the overweight category, and they were at 20 to 40% higher mortality risk of dying, not even morbidity, mortality risk. And then they looked at people 30 and above, so the obesity range, they were at 200 to 400% greater mortality risk. Wow. And in about every place I give that lecture, people just stun drop silence in the auditorium, because it's like, almost people need to know that this isn't it's really a significant factor. So I think number one, the right education and encouragement. You don't have to do those dramatic things. You don't have to run marathons. You can get started slow. And then kind of working with technology that keeps us in these sedentary postures, taking breaks throughout the day, having walking treadmills, having standing desks, having walking meetings. I know with my residents now, we'll go over learning objectives, and instead of in a room, we'll walk. We'll talk while we're walking. We don't have to violate patient confidentiality, but we're talking about various topics, but we're walking when we're doing it. So finding creative ways like that to do it, I think is helpful.
Yeah, I think that's great advice, Ed. I mean, obviously, over here, as you are in the US, in the UK, we're on a relatively tight lockdown at the moment, and we're obviously looking at ways to make people active. And I think some of the messages that we've been giving out as a sports science and an exercise community, and I've been doing, various radio shows and talks and writing articles, one of which you kindly read for me and had a look at, is that we're just talking about any type of movement is beneficial, whether that's a walk, whether it's, if you're lucky enough to have a garden, you can go and do the gardening. Even sometimes of vacuuming your house or doing some cleaning around, any type of movement is great. And you're right, now we're trying to use this kind of physical activity message rather than your kind of formal sport and exercise. And any movement is good movement. I love that mantra that I heard you say last year in Malta. And we've already touched on this kind of, I think we've branded it in the UK, this kind of active couch potato phenomenon. I'm glad you kind of touched on that. So, we're in the UK, we have these guidelines of 30 minutes a day exercise, and 2 bouts of kind of resistance training to work on muscle and bone health. Are you finding in the US maybe that the recent lockdown period is making people more aware of the need to exercise, or is it turning it the other way and people are sitting down more and doing less exercise or physical activity?
That's a great question. And I think probably a little bit of both. I think, I think some people, again, this is, it can be a depressing time for people. So people who've lost their jobs, and, that the depression feeling can be overwhelming and just really, but again, we talk about how exercise can mitigate that and help with that. But I think it also has the other side. It's gave people some time to think about, hey, I can have time to take care of my body and my family, just doing family things. That was one of my big emphases on the President's Council is, we as, and Adam, you certainly do this with what you write and how you espouse, you need to walk the talk. And we need to walk the talk with our families, because we can tell our kids or a spouse or, oh yeah, you should do this and this is good. If we don't model it, they're not going to do it. They're sponges. And, we really, I love the saying 90% caught, 10% taught. If we say honesty is a great virtue and all that, and then the telephone rings, we say, oh, tell them I'm not home. Well, what does that say about honesty? So if we tell them about all this activity and then we don't do it, well, but simple stuff, exactly as you said, we used to do after dinner, instead of talking around the dinner table, we got out and walked. So we're talking about our day while we're walking together as a family through our neighborhood. Ride bikes together. You just play a game of tag together, hide and seek, lawn games. There's a bunch of things you can do that involve, as you said, movement, and just getting us active and getting the heart rate up that are fun and that we can do with our families. And I think some people are rediscovering this now. I think before COVID, people were focused on one thing, focused maybe on a job aspect, things like that. And this has got people thinking in different ways, which is good. And we doesn't require a lot of room or space. We don't have to, again, extensive equipment. But these little things of movement will really make a difference in how we feel and really how we approach the COVID thing. I think it gives us a better attitude of getting through this.
Sure. The reason I asked that question specifically is because one of our governing bodies in the UK, Sport England, have recently released some results of some studies that they've been doing. And they've highlighted the fact that far more people in the UK now are aware of the requirements of exercise, because that's been pushed out to us on a number of occasions now, and government guidelines, we're allowed to go out once a day to get exercise. People are starting to look into this, and Sport England have found that more people are now actually engaging in some kind of activity than they were before. Now, obviously that isn't formal sports or gym related activities, but people are doing more. And I think hopefully if anything good can come out of this horrible situation we're in, one of these things is that people will be more aware of their own health, their own well-being, and how they can go about doing that.
I totally agree. That's great.
One thing we hadn't touched on yet, which I've just thought of, because I've had a number of inquiries about this over the past few weeks from various sources, from people and also from radio outlets and other places, is people are struggling to sleep at the moment. And one of the things that I'd spoken about to some of these was that actually exercise and physical activity can help you sleep. People have said to me, oh, but I haven't got any energy, I'm feeling really lethargic. And it was trying to explain to them, but by doing some kind of activity, actually that will wake you up during the day. And then you'll actually feel a little bit more tired when you go to bed, and you'll probably sleep a lot better. So that was something we didn't touch on that I just wanted to mention quickly. I don't know if you've got any comments about that at all, but.
No, that's a great comment, Adam. And I don't know how it is in the United Kingdom, but here we have a sleep deprived society. Really, people are not getting much sleep, and their jobs, everything else. But you're exactly right. Exercise promotes stage 4 sleep, which is the more restorative sleep. So as you point out, there's been tons of study on mental clarity and thinking skills, and people who get that required our bodies need recovery. Just like a muscle, we don't when we strength train, we don't work biceps on Monday and Tuesday and Wednesday. We have a day in between to let that muscle recover from what we did to it. And the same thing, our bodies need to have that recovery time, and sleep is very important and even as in obesity prevention, leptin and certain hormones that unless we get the right amount of sleep, they're not released as much, and we have a higher risk of some of the bad stuff like obesity and lipid profile abnormalities. So that's a great point.
Sure. We've obviously made this clear right from the start that we're talking about movement's great. So my kind of next question to you has kind of already been answered, but we'll elaborate on a little bit more. So my question was really, is any kind of activity beneficial for health? I know we've kind of started to cover that. And can we start to think a little bit about the exercises that we could do at home, or the activities that we could do at home, while people are still on lockdown, and even beyond that? You know, we said before, we don't have to go to gyms. What kind of things can we do at home that can be beneficial for our health?
Right. No, I think that's a great question, Adam. As you point out, any kind of movement and physical activity. So if we're in a more constrained environment, say lockdown with COVID and all, I think, in general, I think we want something that we like to do, because some people may buy this specific piece of equipment, but they may not really like to use it. They won't end up using it, and they'll end up gathering dust. So you want to find something you like to do. So, for example, dance. Some people like to dance. Dance, that's great. You burn a ton of calories, whether it's ballroom or hip hop or whatever. And, there's, again, electronic dance machines and games and stuff that we can use if you like to dance that can build on that. But that's an easy thing. You don't need much room for it. Don't need much space. You can burn a ton of calories. You probably are looking at the internet now and all the different dance routines that people are making up out there. It's great. And if you like that, fine. If you don't like that, again, there's so many different things. We can use our body weight for resistance. So, you think of a push-up, you think of a squat, you think of, simple body weight exercises that you could do for strength. You think of resistance tubing. You can use just simple resistance tubing to get muscle strengthening for a lot of the muscle groups that we need in both arms and legs. Core training, don't need much equipment for core training. You can do planks and bridges and things like that, get a great core without a lot of equipment. And again, just the movement stuff, just walking around your neighborhood, if that's allowed. If you like an indoor piece of equipment, like a stationary bicycle or elliptical, there's no magic one. It's whatever you like to do. If you like a treadmill, that's great. If you like an elliptical, that's great. If you like a stationary bike, that's great. It's whatever you like to do, that's what you're going to do. So find something you like to do. Some people combine it with, say, they like a specific television program or something, and they exercise while they're looking at the television program. That's great if they like to do that. So combine, and again, families, I think getting the kids involved and doing things together is always good. Having a game of tag or hide and seek or lawn games together, those are always great as well. So again, like you point out, it doesn't have to be fancy. It doesn't have to be a specific sport. You get a ball, soccer ball around the yard, just practice dribbling around. If you like soccer, that can be a blast if you like that stuff. So anything you like to do, anything that's easy for you to do, anything that's practical for you to do, that involves body movement, that's a good thing to do.
Right. Let's move on from that and think about some of the specific populations that might be needing some, let's say, a little bit more specific advice in terms of what kind of activities they could undertake. So I think obviously the first one that might spring to mind would be the older population. And I was lucky enough to see a YouTube clip that you sent me, which was about you being interviewed on the Mayo radio, where you spoke a little bit about some exercises that those are maybe in care homes or those that are a bit more confined can do in the comfort of their own chair or their own homes. Could you just touch a little bit on that first of all?
Yeah, just really, again, basic stuff. I think that we neglect sometimes, when I say I'm just using we globally, we kind of, the simple things are sometimes the best things. So just really walking. I mean, just the more we can move and walk and if you're in walking hallways, if somebody, like we have people that are, our nursing homes are at risk areas. So, but those hallways are quite long. And if we're in a safe space, if we're in that safe confined area, walking is just wonderful. And it gives you almost all the same benefits of running. If we walk consistently, move our body, that's great. Climbing stairs, and again, it doesn't have to be 17 flights, but climbing stairs does a great job at working gluteal muscles and lower leg muscles, activates core muscles. So just stairs in your home, if you have them, that's great. Simple things like squatting. We do that every day when we're, sitting up and down from chairs. So doing a squat with good technique, and that's one thing we want to have is good technique with all these exercises. So we want to make sure our movement patterns are such that we're not putting our joints at risk. And Adam, you've always espoused that. And we have just no plug, but we have a set of videos. If you go to mayoclinic.org, We have 35 videos on strength training with body weight, with tubing, with free weights, and with machines. And it's free. You don't need to log in. Just go to mayoclinic.org and just search strength training videos. And I just say that because you want good technique when you do these things. So, but squats, great exercise that you can do at home. Push-up is like a squat for the upper extremities. Again, if we have good technique, we don't have wrist problems, great exercise for upper body. A ton of things, the plank position or bridge position for core, you know, again, you don't need much to do that. So a lot of these things are really simple and we can work up to them. And certainly when we do the plank the first time, it doesn't have to be for 10 minutes. It can be certainly, starting off slow is certainly fine. And that's another thing I think that demotivates people. They hear these numbers and they think they have to be, you know, at this super level, and it's no, you don't have to be. Starting off with a few minutes is fine. One of my favorite pictures is one patient who lost 250 pounds, and when I saw him, he couldn't walk more than about 30 seconds with a walker. And you know, he said, "I can't do this, doc. I'm too old." And we went back and forth, and finally it was just getting him that 30 seconds to 60 seconds. And then to 90 seconds, and then to a minute and 20, you know, it was those little steps. And so I think don't be afraid to take the little steps first, because sometimes we see the end point, we say, oh, I'll never get there. But it's like climbing a mountain. You know, I was in Colorado one time at a 14,000 foot peak, and there's a 3,000 foot face in front of us. And my guide, I'm saying, I don't know if I can do this, Charlie. And he goes, Ed, he goes, one step at a time. Sure. And sure enough, one step at a time, and you're on the top. So if we can get our patients bought into that, you know, hey, if you're in a nursing home even, hey, one walk down the hallway, that's fine. You know what? Maybe a little bit later in the day, we'll try it again. Maybe tomorrow we'll try it a little longer. Those are the things that build over time.
Yeah, great. That's great advice, Ed. And I think something that we've kind of touched on throughout this is some of the points about technique. And I'm glad you've mentioned the kind of Mayo Clinic links, and we'll make sure that we try and get a link up. Something if my technology brain works enough, we'll get a link up there, because that's really, you know, one of the things that's been really good is there's been a lot of information online from various sources about you must get active, and, you know, videos on how to keep fit. But the fundamental thing is that we have to do those safely and carefully. And there's no real guarantee that everything that you're watching on YouTube or other media platforms is safe in that way. And obviously, coming from a biomechanics and kind of kinesiology background, then I'm obviously keen to support that. So we'll make sure that gets out there accordingly. What about other groups in terms of, I guess the message is the same, really. You know, if there's kids in the house, you know, get them doing something fun. I mean, I know my trampolines suddenly jumped into life in our back garden, and you know, apart from the weekend, which I mentioned to you before we started, you know, when it's been hailing here, you know, I've been on there. And it's interesting you mentioned about starting small. There's some things I can't do on a trampoline. I shouldn't say I can't do. I've not mastered yet at my age, and I'm just building some of those things up. So I'm starting doing 30 of something, and then the next day 35, and then 40. And then before you know it, you find something else that's a little bit more challenging. So that's really key advice. But is there anything in terms of other specialist groups like children or pregnancy that maybe those advice are slightly different?
Yeah, I think it's a great point. And, you know, one of the groups that we want to make sure get their activity too is the disabled. So people who use a wheelchair. So, you know, and as you know, there's some formal things that they can use, like an upper arm ergometer, which is basically like a bicycle you pedal with your arms. But again, even if you don't have access to that, you can do seated upper body weight training. You could push your chair, you know, if it's allowed in the neighborhood, you know, just use your chair for your arms or your legs if you use a wheelchair. So anything that gets muscle mass moving. So if our, you know, again, on our friends who have amputations, things like that, we want to make sure that they still pay mind to that. And that, you know, the neat thing about it, technology today, is that we've found ways to compensate for virtually every disability, and there's no reason why people can't do things. They may have to do them a little differently. So again, a person with a lot of arthritis in the knees, they may not use running, but they may use a stationary bike, or if they have access to water exercise or swimming, you know, if that's allowed, those types of things. So there's just about no disease entity that there is that we can't benefit by introducing activity. So we want to make sure our special groups get it too. As you mentioned, the kids, very important. Pregnancy, absolutely. I mean, there's no reason why it's been shown, especially if you've been active before, that you can't maintain activity afterwards. Certain caveats that your OB will discuss with you, but those again are quite minimal, and no reason why you shouldn't, and really a lot of reasons why you should continue during pregnancy. So again, it's one of those things that just about every group we want to make sure they have that as part of their lifestyle.
Brilliant. Right, Ed, we're going to finish in a minute just with a little bit of a plug for something else that we're doing later on, so we can push that. But just let's finish with a kind of final statement from you in terms of general advice on how people can keep themselves active, but I think mainly motivated to keep exercise and cope with kind of, any mental and physical challenges they're having at present.
Mm-hmm. Well, as you've said as well, Adam, I think the main thing is just, keeping it simple and keeping it something you like, and just knowing that any movement is good movement, that you don't have to be a professional sport athlete. And, we do sports medicine. Anybody who wants to be active can come see us. You don't have to be a professional athlete or whatever. We want to help everybody move and everybody be active. So that movement is medicine, activity is medicine. That's the key thing to remember. And just by taking the stairs, by parking further away, by playing with your family, by taking walks after dinner, you're doing hugely beneficial things for your body, and that it adds up. The activity adds up in a cumulative way. You don't have to do it all at once. You can break it up through the day, but for our physical health and also for our mental health, as you point out, for our sleep quality, it's just the best medicine out there.
Brilliant. Thank you ever so much, Ed, for joining me. The last thing I'm going to do is try and I've just changed our screen, so hopefully that's come up slightly differently. But what I'm going to do now is push something that Ed and I are going to do on Thursday, the 28th of May at 3 p.m. British summertime. So that's 9 a.m. Where you are in Minneapolis, Ed. And we're going to be talking in a part of a virtual lecture series that Solent University, my institution, as you can see behind me in the Spark building, we're going to be doing a virtual lecture called I Like to Move It. You can sing along to that if you like, but I Like to Move It, Health and Wellbeing Benefits of Staying Active. And that's going to be a kind of open webinar, details to follow about that, and people can send in questions. And Ed and I will do our best to answer those accordingly. But let me finish by thanking you, Dr. Ed Laskowski, and we'll catch up soon and stay safe.
Thank you, Adam. It's been great fun. Thanks for all you're doing, and it's a pleasure. Look forward to the 28th as well.
Brilliant. Thanks, Ed.
Take care.